You are listening to ReachMD XM 157, the channel for medical professionals. What is the 50 Million Pound Challenge? Welcome to the Clinicians Roundtable. I am Dr. Renee Matthews, your host, and with me today is Dr. Ian Smith. Ian Smith is currently the medical diet expert on VH1's highly rated Celebrity Fit Club and the creator and founder of the 50 Million Pound Challenge. He is the former medical correspondent for NBC News Network and for News Channel 4, where he filed reports for NBC's Nightly News and The Today Show, as well as WNBC's various news broadcasts. Dr. Smith is also the author of the #1 New York Times bestsellers, Extreme Fat Smash Diet and The Fat Smash Diet. Welcome to the program, Dr. Smith.
Thank you for having me.
Dr. Smith and I are going to discuss the 50 Million Pound Challenge. What is the 50 Million Pound Challenge exactly?
Well, the 50 Million Pound Challenge is a national initiative, a weight loss initiative, geared towards African Americans, but not only for African Americans. And the idea is to get us to lose a collective 50 million pounds. The idea came about because I've spent so many seasons on Celebrity Fit Club being the resident diet guru, and so many viewers would email me saying that they wish they could be on the show, that they wanted to lose weight, that they've been having problems. And so I said, what could I do to help a large number of people at once? Because obviously there are limited slots on the show, and you have to be a celebrity to be on the show. And so I developed this program, which is a national initiative. It's very historic in nature in the sense it's the largest health initiative ever launched for African Americans. And State Farm is my sponsor. And the advantage of having State Farm as my sponsor is that I'm able to make all of this free to the public. So we have a website, 50millionpounds.com. That's 50millionpounds.com. And people can sign on. They get their own free weight loss tracker. They get a free diet plan, an exercise plan. We have online support. And we also give out prizes to keep people engaged and interested. Like for the next 3 weeks, we're giving out a $500 gift card for shopping for Christmas. So the challenge is about getting us to change our lifestyle behavior so that we can reverse the deadly trend of the obesity complications such as type 2 diabetes, heart disease, high blood pressure, stroke, even some forms of cancer.
And can you share with us the main elements for the challenge?
Sure. It all really revolves around the website. The website, once you log on at 50millionpounds.com, you get all the tools that you need to lose weight, and we're able to track your weight loss on an hourly basis by your frequent inputting of what your changes are in your weight, whether they're up or down. And the website reveals what that number is for the total. So right now we're down 1.1 million pounds since April, so we're doing very well. And also there are other things that are involved in the challenge. We have a lot of celebrities who we call challenge champions, and they are encouraged and perform for and talk to a lot of the challengers, and that's been helpful also. So it's a combination of we have celebrity and entertainers involved to encourage the rest of us to lose weight, and then we have prizes to incentivize people, and then we give the free educational materials such as the weight loss plan and exercise plan so that money does not become an obstacle for people who want to lose weight and be healthy.
Now, have you faced any obstacles during the development and or the implementation of the program?
Well, it's not always easy to ask people to change habits. And many of these habits, when it comes to how you eat and how you exercise, tend to be lifelong habits. And so we're asking people to make some changes to some habits that have been pretty much entrenched in their lifestyles for a long time. So that's not an easy thing to do. However, what we're noticing is that when we keep, pounding the pavement and keep talking about the changes and the benefits of making a few small changes in one's lifestyle behavioral patterns, we're noticing that people are catching on. Right now we have over 275,000 people who registered, and every day we have hundreds and hundreds of people who register at the website and are joining the challenge. So the larger obstacle has been getting people to understand that you can make some small changes and actually determine your medical fate or your health fate rather than be resigned to the fact that you're going to be ridden with disease or some type of illness.
What impact do you plan on having on the African American community with this?
Well, the idea is this. If we lose 50 million pounds, I've figured that we could get about 5 million people to lose about 10 pounds on the average. We may have less or may have more. But the idea is that if we can lose this kind of weight, it's not just about losing the 50 million pounds. It's also about increasing the national dialogue about living healthier lifestyles. African Americans live, on average, 5 years less than Caucasians. And if you look at most of the data about diseases, we tend to suffer disproportionately from a lot of the diseases, especially those that are related to our being overweight. So my belief is that if we can get enough people engaged and we can continue the national conversation, and I can continue to appear on programs like yours, then we can get people to be serious about changing these lifestyle choices that are really killing us so early, damaging our bodies unnecessarily.
And where exactly are you trying to take the program? Do you want to go global? Is there any specific health organizations you're trying to target?
Well, I'd be very happy when we lose the 50 million pounds domestically, nationally.
Mm-hmm.
Sure, obesity is increasingly becoming a global issue, but there's no doubt about it that it's truly an issue and a crisis here in America, and it's a particular crisis in the African American community. So my immediate plans are to get Black America not only to lose 50 million pounds, but really take their health seriously and make their lives a priority rather than make other things in life a priority, such as, the cars that you drive or, how well you party. I want us to make our lives a priority above those other things, and then we can enjoy those other things after we take care of number one.
Do you have any theories on why these diseases are so prevalent in this particular population?
Well, I think that there are several reasons why they're prevalent. The easy ones are, the lack of access to health care and to health care education. And I think that this is something that has to do with socioeconomics. African Americans have a larger percentage of people who live below the poverty line. We have a larger percentage of people who have not been well educated, whether it's going on to college or graduate schools. We also have a lot of people who have not been well educated in the health sciences to understand basic health and biological facts. So education and access to health care tends to be a global reason why we have these disparities. But beyond that, there are also cultural entrenchments, and by that I mean there are things that occur and beliefs within our culture that tend to lead us to not make the changes we need to be healthier. For example, we tend to eat a very high-fattening, high-calorie, fried food diet, which has low nutritional value, and that's because transgenerationally we've eaten this way. Our grandparents grew up in the South, and they cook soul food, and, this is how we eat, and we need to learn how to change that style. And instead, I get a lot of resistance from people saying, well, this is how we've always eaten, and this is how I like to eat my food. So this is a cultural entrenchment. Another entrenchment, for women in particular, is the idea they don't like to exercise because it messes up their hair. And it sounds like a silly thing, but it's really true. And it's a true impediment to getting African-American women to exercise and to be physically active because they're worried that the amount of effort it takes to restore their hair to where they want it to be is tremendous. So they skip the exercise so that they don't have to spend all the time getting their hair back in shape. These are just two of the cultural entrenchments that are pretty much unique to us, and these are the things that we're working against.
You're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I am Dr. Renee Matthews, and I'm speaking with Dr. Ian Smith, and we are discussing the 50 million pound challenge. Back to the question before that, do you have any suggestions to our listeners on how to treat this population so that perhaps we can get these statistics to change in years to come?
Absolutely. I think that physicians and clinicians have to take a more active role in the diet and in the lifestyle choices of their patients. I understand that given the medical climate the way it is and the lack of time and opportunity we have to spend with patients, that it becomes difficult to have a very extensive interaction. But it is critical that we, as physicians who are on the forefront of medicine and at the forefront of interaction with patients, we have to make sure that part of our routine interaction with them involves their weight. And we can't be afraid to tell someone, listen, you're overweight. If someone comes into your office because they want to have their eyes examined or they're having an issue, they're having headaches, any problem that may not be related to their weight, you still have to point out to that patient, by the way, your BMI, your body mass index, is probably pretty high, and you probably could afford to lose 15 or 20 pounds. This is the kind of open dialogue that we have to have as physicians, and we can't be afraid to have it. And, patients trust us. And it's a lot different sometimes when someone down the street tells you that you need to lose weight and when your doctor tells you need to lose weight because you may suffer these types of medical problems. That can make a big difference.
I agree. I totally agree. The 50 million pound challenge, have you been able to get any clinicians and physicians to sign on to maybe direct their patients to do the program or?
Well, we have the National Medical Association as an organization has become a partner with the 50 million pound challenge, and that's a good start. But what we really need is we need individual physicians in their own domiciles and their own locations to actually adopt the message of the 50 million pound challenge, to tell their patients, hey, listen, if you're interested in losing weight, because a lot of physicians, when they're confronted with a patient, by a patient who wants to lose weight, a lot of them don't know where to send them because, weight management is not something that all physicians are well versed in. And so what we're trying to do is we're trying to make this very easy for physicians and others and say, listen, just refer your patients to 50millionpounds.com. That's 50millionpounds.com. And on our website, your patients can have free access to all the tools that they need to lose weight, to understand about high blood pressure, to understand about stroke and type 2 diabetes. It becomes a great clearinghouse for physicians who need to send their patients to a place when they may not have the information themselves at their fingertips.
Now, I know that the 50 Million Pound Challenge has traveled to different states. Are you still traveling, and what are you doing now to continue to get the word out?
Well, this year alone, we went to 14 different cities throughout the country, which was a really, really big initial tour. And, this year was about getting awareness and getting people to know and understand about the 50 Million Pound Challenge.
I want to thank Dr. Ian Smith, who has been our guest, and we have been discussing the 50 Million Pound Challenge. I am Dr. Renee Matthews. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. For comments and questions, send your email to xm@reachmd.com. Thank you for listening.